Hello, I'm Denise Hill. I love sharing stories of my experiences with celebrities, politicians, some of your favorite musicians and artists, but most importantly, I love sharing the stories of everyday people. Their lives serve as opportunities to inspire, empower, and educate. It is my honor to share the stories of those who fought the fight against breast cancer and won. The So Alive Project is all about sharing the stories of survivors and caregivers. Whether you are in the fight, a survivor yourself, supporting someone who is in the fight, or just want to be informed, my hope is that this story will bless you. Please make sure you subscribe to this page or set your notifications on all social media so you don't miss one. I am at The Denise Hill. One of these stories just might change your life. I'm Denise Hill, and this is the So Alive Project. I'm here with Dr. Sheri Prentiss. How are you?
I'm good, love. How are you?
I'm fabulous. Thank you so much for sharing your story and your time with us. I just feel it's important that people share their story, their testimony, because, you know, we're inspired and educated and freed by the testimonies of others. And so I don't take for granted this time you're sharing with us. Thank you.
It's my pleasure.
Let's start at the very beginning. How did you get diagnosed?
Well, actually, on October 1st, 2008, I was performing my own self-breast exam, and I found a mass. And the moment that I touched it, I knew that it was cancer. And I'm not a pessimistic person. I love the Lord. I'm saved, sanctified, and Holy Ghost filled. But you know when something is not right. When you know you're normal, you know when something is abnormal. And it just dropped in my spirit that I knew that it was cancer. And I was blessed enough to have a breast surgeon in my back pocket. She had been in my back pocket because I had walked through the breast cancer journey with a coworker and a dear friend. And just as I had handed off that patient because she was done with her journey, lo and behold, October 1st, I found my mass. And I called my surgeon immediately at home and said, hey, listen, I found this mass. What are we doing? Are we doing a mammogram? Are we doing ultrasound? What is it that you want me to get? Because I need to get this thing out.
Wow, that's powerful.
Yeah, and I went in and had a diagnostic mammogram followed by an ultrasound, and went in for my biopsy. And on October 13th, I'll never forget it, she called me at home, and when I answered the phone and she gave her name, you know, I did what I normally do. Hey, Barb, how you doing? Just as joyful and as peppy. And she said, Sheri, I would be doing a lot better if I had different news. And at that moment, I just can't tell you how that sunk in my heart. And she said it came back invasive ductal carcinoma. And so we need to get you scheduled for surgery. And I ended up undergoing a partial mastectomy, 15 rounds of chemotherapy, and 33 treatments of radiation.
Wow. But how powerful is it that you were already somewhat educated on the process, on probably some medications? I mean, tell me how much education you went in with other than just the experience of walking a loved one through the process.
Well, you know, as a physician, I had given the diagnosis many a times. And so now being on the other side of the table, it was interesting because I did go in with a certain amount of knowledge, understanding what could be presented to me as treatment options and what I possibly may go through. But, you know, when you live it, it's completely different than when you are on the other side of the table writing out the prescriptions or doing the procedures. And so sometimes my knowledge helped me, and then sometimes my knowledge worked against me because my head would like run ahead of where I was at the moment. And the Lord really needed to just slow my mind down because I was already trying to work out the next case scenario. And I really needed to pull back. And he did give me that peace to just kind of settle my mind and to go into patient mode. As a physician, you know, you want to be quick on it and, you know, kind of direct care. But now I couldn't tell my oncologist really how to direct my care, but at least my experience did allow me to ask certain questions that maybe a layperson wouldn't have known to ask. So so that did help out. But really, I did go into full patient mode. I really was able to appreciate how important it is when a woman is given this diagnosis, or a man for that matter, because, 2,200 men will be diagnosed with breast cancer. But it really makes a difference if you take someone, a caregiver, a friend, a loved one, a coworker, I don't care, somebody with you to those first initial appointments, because you're getting that information, you're asking questions, but probably only 25% is really landing on your brain. The rest of it, your mind is just looking to the future and asking yourself, will I even have a future? And if I do, what will that future look like? So it helped in I would say in most instances, but there were some times when my knowledge did kind of work against me and I had to take a step back.
And what is your specialty as a physician?
My specialty is occupational and environmental medicine. So I work with preventative health. I do wellness programs. I'm considered a work comp doc. So I take care of workplace injuries and illnesses and work with CDC and EPA. And like when the H1N1 swine flu came out, I was actually in the midst of my chemo, but I'm the doc that organizations came to develop their emergency preparedness plans and work with hospital systems to make sure that everybody experienced a safe and healthful work environment.
All right, 2 snaps. Hey.
Yeah.
I love it. But that also goes to show that this thing has no respect of person at all.
No, it does not. I tell individuals there was a time in my life, and not in the too distant past, that I was the national spokesperson for Susan G. Komen for their 3-day program. And one of my favorite things that I would say when I would do interviews while I was in that role is that breast cancer doesn't take a break, and neither should we. I mean, it hits all age groups. There was a time when we used to think that this was an older white woman's disease, and it never was an older white woman's disease. It always hit us. But I think as minorities, we're now getting more press, more newsworthy stories, because even when we control for things like socioeconomic status, education, we are still dying at a 40% higher rate than our Caucasian counterparts. And so I have seen women who have been diagnosed as young as 16.
Wow.
I've heard of stories of a young girl at the age of 13 diagnosed, but I have physically seen individuals diagnosed as 16 and women as in their 90s diagnosed, and from all walks of life and all ethnicities. But we, as minority women, we are still struggling with the disease. We're still struggling with the treatment. We're still struggling tremendously with the amount of health disparities that go along with this disease, and we're certainly dying at a higher rate.
As a physician and a former patient, what is the bridge between traditional medicine and holistic medicine?
Good question. I think let me first acknowledge that there is a bridge. There was once a time when there was the train of thought that they were two unrelated things, that you either had to get treated with some form of medication, and if it wasn't a prescription medication or something that a doctor wrote for you, that everything else was just a fluke. And that is simply not the case. We know that back in ancient times, before all of these pharmaceutical agents came into being, there were individuals that were living long and fruitful lives. And that came from the elements of things that grew out of the earth that God has given us. And so there is now that bridge between medicine and holistic medicine. And that holistic medicine has been termed functional medicine. I don't like the word alternative because it's like alternative to what, but that has been a term that's been used. But I think there is reasons and cause for utilizing both. I certainly did. I utilized both forms, and I had individuals, tell me that my that my faith was questioned because, well, why are you getting all of this chemo and why are you going through radiation and where is your faith? But faith without works is dead. And so my works was going through my treatment, knowing that ultimately God was going to be the one to heal me. But I also had physicians who understood that I believe that there can be a limit to certain medications, and where that medication cannot penetrate, there are certain holistic methods, whether it be acupuncture or herbal supplements or what have you, that can also complement traditional medicine to help make that individual whole.
I'm going to go back to that faith thing because I'm going to go back to that, but I'm going to ask first, can you share some of what you utilized holistically and even some of the traditional medications that you were on that perhaps somebody who is in the middle of this or even at the very beginning, they can listen for these things or research these things before they have to be encountered with them?
Sure. Well, for my chemotherapy, I received adriamycin and Cytoxan, and then it was followed by Taxol. As far as the herbal routes that I took, I made sure that I had my omega-3 and 6 fish oils. Even though I lost my hair while I was going through chemotherapy, I used products that were geared towards healthy hair, skin, and nails, because there are certain things that your body goes through, especially with the chemotherapy. Individuals have their nails turn black and their skin turn colors, and it's more difficult for their hair to come back in. So I took those products even while I was going through chemo, even though there were some thoughts that, hey, all you're going to do is the chemo is just going to wash that through your system. But I just wanted to keep my cells primed. And so I can honestly say whether or not it was due to the supplements or not, but my testimony is my fingernails didn't go through that very dark black look. My skin did not go through as many color changes as other individuals have gone through. I maintained a healthy immune system with taking things like vitamin C, vitamin E, making sure that I took things like sambucol, which works on your immune system. And so I would tell anyone that if you are taking any herbal supplements or you are utilizing any adjunctive therapies in addition to chemotherapy or other medications that your doctor may be prescribing, tell your physician first, because there are certain supplements that could counteract and not work to your benefit if you were taking them while you were going through chemo and other forms of treatment. So no matter what you're taking, no matter how ubiquitous or unharmful that you may think that they are, tell your doctor first and let him or her talk with you and explain to you why you should hold off on taking this right now or why you should continue taking it along with whatever prescribed treatment they've given you.
Oh, that's great advice. Powerful advice. Thank you so much. Can you delve more into I have to laugh when I say it because, I mean, unfortunately, especially in the African American church, folks are kind of, for lack of a better word, they'll be judgmental, or everybody has an opinion about how you should behave and what measure of faith is enough or not enough, or if your actions just in the African American church is something we got to work on. But
yes,
how is it that those conversations, came up? I was speaking with one survivor where she was determined to just keep everything kind of to herself until everything was resolved, and then she could come public with the fact that she was going through this because she wanted to avoid such things. So how did you end up in those types of conversations that your faith would be questioned, and how did you respond?
Very good question. Well, it was such a tremendous undertaking in my life to deal with that. I actually wrote a book about it. And my book is entitled When Everything Changed, My Journey from Physician to Patient. And I took a whole chapter out, and it's called Churchy Chatter. And I've been in the church all of my life. My grandmother was the first female pastor ordained in the Churches of God in Christ. And so, I'm surrounded by bishops and apostles and elders and ministers, and I'm a licensed evangelist myself. And it was interesting because as a physician, people came to me all the time. I was the only physician on either side of my family, the only one in the family for generations. And so anytime anybody had a problem, it could be a hangnail on their toe, they would reach out to me. But now that I'm facing a life-threatening illness, now all of a sudden when it's me receiving, quote unquote, all of this treatment, when it was said to me, well, we just going to get together and we going to pray. And I said, well, I hope that you will pray. Pray without ceasing. Yes, continue to pray. But it was later revealed to me, like, well, after we prayed, you still got chemo next week? You going to go? Well, yes, I am. I thought we was praying, that maybe, I won't get as sick the next time, or maybe my white blood cell count won't drop as low. But I didn't realize that we was praying that my mind would change, that I would not go ahead with treatment. And I literally had to respond with that scripture, faith without works is dead. And so I had to remind individuals that I am sharing my story, and I'm being very vocal with my story, because no one, if I suffer in silence, no one benefits from seeing my testimony unfold. And so if you can have the slightest little headache and you're calling me, asking me what you should do about it, then if you trust my opinion, then you got to trust my opinion from a natural standpoint, that I know what to do and what's best for me. But then from a spiritual standpoint, I have been up in the pulpit, and you know that I know the word of God. But the Bible tells us that the sick have need of a physician. Faith without works is dead. We know that God is the healer, and that by his stripes we are healed. But at no time in the Bible does it describe that you're supposed to ignore what your doctor has recommended to you and just simply have faith that I'm going to heal you. God will only do what you can't do. There is no reason for him to do what you can. And what I could do was get up, drive myself to chemo every week, drive myself to my radiation treatments every day, and make sure I went on ahead and had surgery and had my staging done so that I do what my future looked like. So I had to come out and be very, very real. And it was probably, I'm sure, words that others didn't want to hear. They were certainly words that I didn't want to say, but I had to confess them nonetheless, because it's too difficult to have a person feel like they have to go through this alone because they're going to be shamed or rebuked or have their faith questioned. If we read the book of the divisions of Psalms, oh my goodness, David went through some serious depression. And the other writer went through some serious depression, but he confessed where he was, and then he gave it over to God. And so me stating that I'm tired of chemo and it's so much pain and it's so hard. I even got rebuked when I would confess how hard it was, because there was that viewpoint that I should be strong. You don't wipe those tears. You're an evangelist. You need to be strong, and God's got you. Wait a minute. No, Jesus wept. So let me cry. Let me do what God is leading me to do, because I, as a physician and as a person who loves the Lord and is saved and sanctified, I have seen many women die from breast cancer professing faith. That we're going to pray about it, and didn't get any treatment. And they've left children back here to be raised just with their dad, young girls before they've ever even come into maturity without their mom, and their dad has to take on this load because they were going off of faith. So I ask you, where was their faith?
And I venture to say that as someone in your profession and a woman of faith, you've seen also the connection between the stress that we put on ourselves mentally, emotionally, and physically, and how that manifests itself in our body. So to ask somebody who's already dealing with a disease dealing with cancer, to now hold in more stress and hold in more trauma. It's amazing to me.
It is. And, stress was my biggest risk factor. I was the first person diagnosed in my family. There were no first-degree relatives. I had no other significant risk factors other than being Black and female. But stress, huge. And so for me, when I had kind of set some people straight that, stop asking me week after week, am I going next week for chemo? The answer is yes. But when I had gotten through, it was just only my third treatment of chemo. I remember I was at home and I had crushing chest pain, and it felt like an elephant sitting on my chest. And I knew what that meant. And I was just so tired and so done until, instead of dialing 911, I went upstairs, I pulled out my life insurance policy. I left it out so that my ex-husband could find. And then I climbed into bed. I said my prayers, and I asked God to be with my mom when she transitioned, because she was in the end stages of her life. And I just wanted to go home and be with the Lord, because I was just sick of all of the chatter. And somewhere in the midst of the pain, I fell asleep, and I woke up. I have to admit, I was angry with the Lord. I thought, man, Lord, I made this real easy for you. You just could have called me home. And no, here I am. And, I lived through that, but 4 weeks, before I go into what happened 4 weeks later, I was subsequently rushed to the hospital. And as it turns out, the chemo was constricting my blood vessels, and it revealed that I had a congenital heart defect where my right coronary artery was being squished in between my aorta and my pulmonary artery. So I was on my way to a massive heart attack.
Wow.
And didn't know it. And the cardiologist tried to put in 22 different sites, and none of them worked. So he sent me home on some lifelong medications. And 4 weeks to the day of when I got home, my mom died. And I just felt extremely lost and alone. And I felt like as soon as I had kind of built myself back up and I told everybody off and I got myself straight, and then to get hit with this congenital heart defect and then to lose my mom, it kind of sent me reeling. And it wasn't until about May of that year, when I was in between chemotherapy and radiation, that I fell down before the Lord, and I just cried out, because I realized that I was suffering from depression, because I had not fully grieved my diagnosis. I hadn't grieved the loss of my mom, because I was just trying to plow through getting through her homegoing. I was an executor of her estate, so I'm just trying to do everything I needed to do so that I could live through my own life-threatening diagnosis. And now I realize that at the time that I was willing to die, because I didn't want to be here anymore without my mom, God had already reconciled with my spirit that had I died, my daughters would have been here without theirs. And so I knew that I needed to be here. I knew that God had allowed me to live for a reason, but I was struggling trying to figure out what that purpose was and what would become of my future, such that this would now work together not only for my good, but for the good.
That is powerful, and some great encouragement for somebody who perhaps is faced by the same kind of, and I'll say well-meaning people who are just operating from their point of view and their level of understanding, but can be very hurtful with their words and a bit traumatic. You just gave a lot of insight and inspiration and empowerment to somebody who perhaps is being faced with some of that same chatter.
Yes.
Wow.
Yes. I hope that my story, that's one reason why I tell it. I'm remarried now to a man that I went to high school, college, and med school with, and we didn't reconnect until 2012. But he is a much more private person than I am, and I had to tell him when we were dating, I said, "Sweetheart, I need you to understand my life is an open book. It is open because people always have looked at me because I'm a physician and God has blessed me to go to some great schools, and I've graduated either valedictorian or salutatorian or honors from them, that they automatically expect that I'm going to be strong, that I can, stuff is going to hit me and I'm going to be strong and I'm going to get through it. And I have to remind people, especially people of faith, in my weakness, God is made strong. So I'm not strong. There were plenty of times when I was sick and I was weak and I wanted to die. But people need to understand that there is a process that individuals go through, and they need to be understanding and step back. I realize that your loved ones hate that they can't do more, but that can't stop you, the person that's going through, from being, that can't cause you to be silenced or sequestered in your feelings. Because like I said earlier, no one benefits from your testimony unfolding. And you need to confess where you are in order for you to formulate a plan to get you to where you want to be. Without that confession, it doesn't happen. And that confession needs to happen out loud or on paper. I chose to do both. I'm an open book on social media, and I chose to write it out when I wrote my memoir, to share with others my story so that their journey would not possibly be as long, as hard, or as painful.
And can you give your social media?
Yes. People can find me on Facebook under Dr. Sheri Prentiss. That's Sheri Prentiss, Prentiss. I can be found on Instagram at DivaMD7. That's DIVAMD7. And on Twitter, I am Dr. Sheri MD. If I'm not mistaken. No, it is Twitter that I am Diva MD7. It's Instagram that I'm Dr. Sheri MD.
And do you have any support groups or anything that you can recommend?
Oh, yes. Actually, I have a nonprofit. It's called the Live Today Foundation. I started it 2 years ago. It is a organization where our mission is to provide joy, inspiration, and free compression garments to under-resourced and underserved cancer survivors living with lymphedema. When I came through my treatment, my lymph nodes in my right armpit were completely destroyed, leaving me with a condition called lymphedema. So I have permanent swelling of my arm, hand, and fingers, and I have to wear compression garments in order to control that swelling and to prevent infection. And so what I found is once I was diagnosed, a lot of people just blew me off, even some physician friends of mine, by saying, "Oh, is this a swelling? Thank God you're a survivor. Yay, you're alive." And I don't discount. I thank God that I'm alive and that I'm a survivor. But lymphedema stripped me of my lifelong dream. I am now clinically disabled from performing the clinical functions of my job as a physician. And I have been for the last 10 years. And I had to completely reinvent myself as a professional speaker, as a healthcare consultant. And I realized that many people either didn't understand what lymphedema was, physicians didn't know how to properly diagnose it, so we educate physicians on how to properly diagnose it. We also educate physicians about the psychosocial impact of lymphedema on a survivor's life, the financial added effects. One, you got to buy new clothes because one limb is bigger than the other, so your clothes don't fit. Your compression garments could cost you anywhere from $350 to $2,500 for a pair of custom garments. You have social anxieties, intimacy issues, changes the way you wear your hair, the type of clothes you wear. You look for things that are pullovers instead of, things with buttons and little zippers. And then the biggest thing is we educate patients that treating your lymphedema is important. It is not just some swelling, so don't just go without treating it because it's going to get worse, and it is something that we don't have a cure for at the present time. And then because of the financial impact, we provide free compression garments, like I said, to under-resourced and underserved cancer survivors living with lymphedema. And if anyone wants more information, they can go to www.live-today.org, and they can find out all the information about the Live Today Foundation.
That is as phenomenal as you are.
Oh, thank you, Denise. Thank you.
Thank you so much for your time, your transparency. Thank you for sharing your story. Any last words?
My last words would be that there can be life, health, and happiness after breast cancer. It really requires, again, confessing where you are, that you are not fine to yourself and to others. It entails going in, getting your get your screening mammograms, know what your normal is, choose the right lifestyle choices for you, and know your family history. And if you're diagnosed, follow your physician's instructions. If you're not happy with your current physician, find another physician. But make sure you go and you get treated. You can have faith and get treated too, because your treatment is your works. And remember, God honors your faith and he honors your work. He wants you healed and he wants you to live a testimony. And God does not cause cancer on anyone. He allowed it to happen to me so that my testimony could be a witness to other individuals. Allow God, if it happens to you, allow God to do the same thing through you.
Dr. Sheri Prentiss, author of the book When Everything Changed, My Journey from Physician to Patient. Thank you so much.
Thank you, sweetheart. It's my pleasure.
My hope is that this story has helped to educate you, empower you, and encourage you. We offer all the love and support we can for those who are in the darkest of moments, and we celebrate that we're so alive for those who have been victorious and survived the great challenge they call breast cancer. Most importantly, I honor the legacies of those who are at rest from the fight. I appreciate each and every person for their willingness to share their story, and I look forward to bringing you more. Make sure to follow me on social media. I am the Denise Hill. You stay blessed.